Hi, I'm Dr. Brent Thompson, and here's some information on pain and inflammation. You know, as a chiropractor, I see this in my clinic every single day. People come in with a lot of pain, but often that's associated with the body's normal response, which is inflammation, right? So pain is really your body's alarm system. The brain senses, hey, there's something wrong with this particular area. I've hurt my hand, I broke a leg, I have a bruise here, and the body responds by sending a signal to the brain through nerves called nociceptors. And you know what? People experience pain differently. So what I might feel as pain, you might feel as a different kind of pain. So sometimes people tell me all the time, I have a really high pain tolerance, or I can deal with a lot more pain than others, and that's great. But our brain is really saying, hey, there's something wrong in this area, and I'm super busy doing all this other stuff. I need you to pay attention to it. In the United States, pain and inflammation cost about $550 billion per year in treatment, lost wages, and lost days at work. So if there's other ways of managing pain and inflammation, this is a good idea. So most of the time we pick a medical option for pain and inflammation. We try and use a medication or a drug, and really what that does is it tricks the brain into thinking that there isn't a problem when the problem is still there. So if I hurt myself and I have a bruise, or if I'm in pain and I use a pain medication, I'm simply cutting off the brain's ability to process that pain when that problem is still right there, and I haven't done anything to actually fix it. Inflammation is a little bit different. So inflammation can come in the body in a natural way, so that's natural chemicals, white blood cells that the body uses to say, hey, there's something going on down here, there's an injury, I've sprained my ankle, or I have an inflammation because of an infection, a virus, or a bacteria, and that's a normal response in the body. The problem with the body is it's really, really good at mounting the inflammatory response, but it's not so great at getting rid of it. So if you've ever sprained your ankle, you know your ankle swells up like a grapefruit, and that's good. We want the body to do that to help protect the area. But the problem is that once the inflammation or the swelling is there, the body doesn't have super great procedures to get that inflammation down. So we need to choose other things like ice and other products that are going to help to reduce that. Here's another really interesting thing. Healing is very difficult in an area that's inflamed. So the body is busy doing that inflammatory response and saying, hey, there's an issue here, I'm trying to protect it, I'm trying to deal with it, but it can't really heal at the same time. So healing and inflammation are kind of a one or the other situation in the body. So we really have to get that inflammation under control, but we also have to understand why it's there. So if you're inflamed in a particular area, say you have an inflamed knee or something like that, we need to figure out why you do. Do you have an infection? Or are you fighting some kind of other disease? We understand that process, and then we get that inflammation under control so that we can actually allow the body to go through its normal healing process. So one of the things I recommend to my patients all the time is icing, 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 icing. I preach ice because it's free. You can put it exactly where you need it, and it actually shrinks the tissue. So you're pushing out the waste products that the body produces naturally, but we don't want them there anymore. They're done. So what we do is we put the ice on, we take the ice off. We repeat that every 5 to 10 minutes on and off for about an hour. And it's just like wringing out a sponge. So you take a dirty sponge in your sink, you're not going to go under the water and go squish and put it on the counter. You're going to squish, fill it multiple times until that sponge is clean. So next time you have an inflammation or swelling or pain in an area, think about that. You want to get those waste products out. And as the tissue swells back to its normal size again, it'll bring new blood, new nutrients, and new goodness to that area and help it heal even better. Another tool that we can use to help with pain and inflammation are essential oils. We all know that our medical route is one great way. Obviously, we just mentioned ice, but another natural way where we use the earth's natural goodness is through essential oils. doTERRA has a proprietary blend called Deep Blue. I use it in the clinic all the time to help people deal with their pain and inflammation. And it's basically a mixture of different essential oils that are really amazing at managing those two situations. So you can put it right on the area. It comes in two forms. It comes as a liquid, as an oil blend. It also comes in a cream, which allows the person to put it directly on and move it around and keep it there for quite a while. If this was a valuable video for you, Please share it with your friends, give it to someone who doesn't know or may have had an injury like this and needs some extra care. If you have more questions about this or any of the oils that I've mentioned, feel free to check out our other information for more details. Have an amazing day.